Good morning and welcome to Radio Friends on Tuesday, November the 11th. November is National Diabetes Month. You know, last week we were talking about it. We had a registered dietitian on from the university. Today we have a young gentleman who is dealing with diabetes himself, CHRIS Fulton. Good to have you here, Chris.
Thank you. Nice to be
now,
here.
You have type 1 diabetes, right?
Yes.
So this is something that is very close to you, something that's very important to you.
Yeah, definitely.
To get the information out about this symposium that's coming up on November the 15th, actually this coming weekend, this Saturday, November 15th. But tell me, there are two different types of diabetes, correct?
Sure.
What's the difference between the two?
So type 1 diabetes is an autoimmune disease where basically your body just stops producing insulin. Your insulin-producing cells attack themselves, and you no longer produce insulin.
This is what you have?
This is what I have, yes. And it's pretty commonly diagnosed in younger kids. It used to be called juvenile diabetes, but now you can see it diagnosed in anyone regardless of their age. So I was 17 when I was diagnosed, though.
How did you find out that you had diabetes?
Basically, I was working out a lot, and I kept having I lost about 15 pounds of muscle, and all of my lifts were going down while I was working out, and I was trying as hard as I ever had, but everything was getting worse. And also a side effect of not taking insulin, which was my body was not producing insulin, is you end up having to go to the bathroom a lot. And so those two combined, I talked to my uncle who was a doctor, and he said you should probably go and get checked out for diabetes. And so I did, and I did that.
And you were diagnosed with type 1 diabetes?
I was diagnosed with type 1 diabetes,
okay,
yes.
So what you have to keep it under control is a diabetes pump.
Yes, an insulin pump.
An insulin pump, and thank you, an insulin pump on you. And you were showing me this. You've got a little tube that is always inserted into your body.
Yes.
It's attached by adhesive tape, and then you've got a line that goes into that is continuously giving your body insulin.
Yep, right into an insulin pump.
How often are you getting these injections of insulin?
Well, there's what they call a basal rate, which is what is kind of continuously running, just kind of as setting the foundation of your insulin rate. And then after that, whenever you consume anything with carbs, so you drink juice, you eat a sandwich, those things all have carbs. And basically, people with diabetes have a ratio of however many carbs they have to take a certain amount of insulin. So then I'll go in and add that amount to
So you have to keep track of this?
Yeah, I can tell you the carbs in just about anything.
So you will adjust that pump depending on what you have just eaten.
And also when I test my blood sugar before I eat, before I go to bed, those two factors determine how much insulin I give myself for a meal.
And this is something that people who do not have diabetes just take for granted. Your body automatically does what it's supposed to do.
It was initially definitely a shocker. And it's interesting, just in 4.5 years, I can't even imagine not having to count carbs, not having to do the things I do before and after I eat. It's just kind of built into my everyday life so much now.
Do most people have the pump like you, or do the majority of the people just give themselves a shot each day?
Only about somewhere in the range of 30% of people with type 1 diabetes have an insulin pump. A lot of the younger people with type 1 diabetes are more okay with the idea of using the technology, having something constantly attached to them, but definitely most people don't have a pump. They do injections every time they eat.
Okay. Well, you're going to find out. And then type 2 diabetes is what?
Basically, your body is building up resistance to insulin. So you've eaten a certain number of carbs, you've eaten a lot of food, you've drank a lot of things with carbs in them, and your body's insulin's become less effective on you. And this can be impacted by that and also just by genetics.
So then do you give yourself a shot then?
Some people give themselves shots. Some people can just simply be on oral medication, and that's all they need to do, and then watch their diet and exercise.
Now, if you want to find out more about this, if you have diabetes or if you have someone that you love that has diabetes or you're just interested, there's going to be a special event this coming Saturday, November the 15th, 8:30 a.m. until 11:30. Where?
It's going to be at the Women and Children's Hospital, which is right at 63 and 70.
That used to be Old Columbia Regional Hospital. It used to be Columbia Regional Hospital. Yeah, so it's Women and Children's Hospital. You haven't been here long enough.
I haven't been here long enough to know that.
It used to be Columbia Regional Hospital. It'll be 8:30 to 11:30. What's going to happen?
Basically, we're going to try and break down all the big issues that anyone with diabetes has to deal with, whether it be carb counting, planning meals, knowing about new technologies, new insulins, new sensors, new, the artificial pancreas, these things that we hear a lot about in the diabetes community, but we wonder if it's just all talk or if they're really going to happen. And so that's all going to be wrapped around by a fun theme called Diabetes TV, where we're going to have an MC, one of the doctors at the endocrinology at the Cosmopolitan International Diabetes Center here at MU Hospital. And we're going to try and keep it entertaining, keep it fun. We'll provide food, and we'll kind of finish it up with a bunch of the people from the organization that I am part of, Students with Diabetes, trying to get everybody motivated about continuing to manage their diabetes effectively.
Right. Now, I'm looking at some of your workshop sessions. It's called Carbs of Our Lives. So let's take off on Days of Our Lives.
Yes.
How the Grinch Planned Holiday Meals. How the Grinch Stole Christmas.
Yep.
As technology turned, well, that's a soap opera that's not on the air anymore. The Weakest Attitude and Exercising with the Stars. Seating is limited. You got to register. What does it cost to register?
Sure. So it's $5 in advance. You need to come by MU Hospital at 1 Hospital Drive and go to the Diabetes Center there. If you want to pay in advance, it'll be $5. At the door, it'll be $7.
Okay.
We can only hold 100 people, and this is something that tends to fill up.
Okay.
And so definitely, if you want to take part in the activity, get in there.
You should do it today.
Do it today.
Because today is Tuesday, and it's coming up this coming Saturday. And will there be demonstrations about like that pump that you have on?
Yeah, so we'll have people talking about the technology, and we'll also have different companies that sell insulin pumps, pharmaceutical companies outside who can tell you about it.
But nobody's going to be able to actually try an insulin pump there, are they?
You could definitely sign up with one of the pump providers to start like a 30-day trial for free if you wanted, but they will not be hooking up the device to you.
Okay, that's what I was asking.
Yeah.
So there won't be any hookups that day.
No, sir. No.
Okay. Well, CHRIS Fulton, thank you so much for coming by. Really knowledgeable, since you know firsthand you are dealing with this. And we want to thank Kit Salter also for hooking us up with this.
Thanks.
We appreciate it.
My
Mark it
pleasure.
on your calendar this coming Saturday, November the 15th, 8:30 to 11:30. All right, we're out of time for today. Want to remind you that if you enjoy listening to KBIA and Radio Friends, you might consider becoming a member. The membership drive is going on right now. 882-9136 is the number to call. They'd appreciate a buzz from you and a pledge. Our program directed by Travis McMillan, Reynolds Journalism Institute. Audio is Pat Akers from KBIA. Our floor director, Lowell Thomas, and our assistant producer and guest coordinator, Uncle James Mauser. Bye-bye.